So when it comes to progression of psoriatic arthritis, we really don't know who progresses and who doesn't. But I tell all my patients that have psoriatic arthritis that, it is an autoimmune disease. There is a theoretical risk of progression for everybody that has psoriatic arthritis. When it comes to progression, if you're having a lot more flares than you did previously, that should clue you in that the disease is progressing. Certainly, if you have evidence of radiographic damage, which wasn't there at baseline, that's another way to know that your disease is progressing. And also, if you have psoriatic arthritis that's increasingly affecting your quality of life, that should clue you in that your disease is progressing. So when it comes to PSA, certainly if a patient has obvious clinical deformities or they have erosions on radiographic imaging, I would say that they have moderate to severe or even severe PSA. Psoriatic arthritis is an autoimmune disease, which basically means that your immune system is like a little revved up and it's fighting its own joints. The goal of treatment with whether it's, DMARDs, biologic DMARDs or biologic injections is to stall, hopefully completely stop the progression of disease. And how these medications work is by fixing the immune system so that it doesn't actively attack its own joints. And then it needs to be understood that, for the most part, it's like a trial and error process. Like, we as physicians might prescribe a medication for your psoriatic arthritis. You'd have to give it time to see whether there's a meaningful response. And sometimes that response might not be achieved. So we switch to a different medication. So this process can be a slow, laborious process. So you have to be sort of patient with it because unfortunately, we haven't quite reached the stage of precision medicine where I can tell by looking at a patient what will work for him or her.